Helping others. Picture yourself about to leave a shop and you see someone with a broken arm. Would you stop to open and hold the door for them? Imagine yourself waiting in an elevator and you see someone in crutches struggling toward the doors. You might choose to hold the doors open until they're safely inside. Most of us are happy to help others in these circumstances because it makes us feel good, just as much as it is to receive help from others. But what about people in poor mental health? How can we tell if someone is suffering from psychological pain? Surveys show that 1 in 4 of us will suffer from severe mental illness. The truth is that most of us will suffer from some form of mental health problem, even if not severe enough for a diagnosis. This is because our mental health isn't fixed, but exists on a spectrum, just like our physical health. And like our physical health, it moves back and forth on this spectrum over time. So what are the signs to look out for? Poor cognitive fitness changes our behavior as well as our mood. If we mask our mood by putting on that happy, smiling face, we can't always cover up our behavior. So what changes can we look out for? Case 1. We probably know colleagues who are usually calm and organized, regardless of the situation. They might have an odd day when they show emotions by getting upset or angry, but this would be an exception. Suppose we see their good behavior deteriorate over days, weeks, and months. Is there a reason for the change? Case 2. Another colleague might be a good problem solver, always available to give help and come up with a solution. Now, for some weeks, they are reclusive, reserved and withdrawn. What's brought about this change? Case 3. Imagine a friend who has a brilliant memory, is always able to recall past events. Who was there, what was said, and what was the outcome? Now they are unsure. Their memory is fuzzy, and they lose track of the conversation, drifting off into irrelevances. Case 4. In the worst of cases, we might observe colleagues adopting coping mechanisms that are not just unhealthy, but totally unacceptable. They might bully others or behave inappropriately. All of these cases could be indicators that our colleagues are not in good cognitive health. You can help them if you notice their change in behavior. Based on what you now know about the 5 core cognitive fitness domains, could you relate a behavior or mood change to any one of these cases? Poor organization and planning to executive function, poor problem solutions to working memory, poor recall to episodic memory. If you can connect a change in mood or behavior with a cognitive domain, it gives you the opportunity to have a conversation with someone about their cognitive fitness. Because we can train our cognitive fitness, any deficits that have developed can be reversed and strengthened over time. So if you notice a change in behavior, could you link it back to their cognition and start a conversation with this in mind? Not only could you help prevent their decline, but your help could go on to improve their health and bring about other benefits. And one day, they might even be there for you. Remember, some pain isn't visible, but the effects are there if you're watching.